Hi, everyone. Welcome and thank you for joining us for the November episode of Chang Reaction. My name is Taylor Young, and I am the Assistant Director of the National Keratoconus Foundation. We are a patient advocacy program based in Southern California at the University of California, Irvine. NKCF provides information to patients and their families and raises public awareness of this cornea disease. We invite you to visit our website, nkcf.org, and sign up for our newsletter, and to register for our bi-monthly webinars. We also post news on our LinkedIn, Instagram, and Facebook pages. This is episode 8 of Chang Reaction, our Ask the Expert podcast. Our partner for this endeavor is Dr. Clark Chang, a noted keratoconus expert and friend of NKCF. We often receive questions about life with keratoconus, and Dr. Chang has offered to share his advice on these questions. NKCF records and archives these episodes for the public. You can view past episodes by going to nkcf.org/webinars. Dr. Chang is currently the Director of Specialty Contact Lenses on the Cornea Service at Wills Eye Hospital in Philadelphia. He is also a member of the medical affairs team at Glaukos, which is the company that makes the FDA-approved crosslinking product and equipment. He is a graduate of the Pennsylvania College of Optometry and a fellow of the American Academy of Optometry. Dr. Chang was also named the NKCF Top Doc in 2020. Hello, Dr. Chang.
Hi, Taylor. I can't believe we're coming up to a year. Episode 8. How did that happen?
I know. It's been fun and it's flown by, honestly.
Yes, shows you what we could do to still be all together despite this strange time that we're in, where where we're mostly getting familiar with our virtual tools and everybody meeting online. But I'm really excited about us meeting each other at the American Academy of Optometry next week.
Me too. I'm looking forward to seeing everyone in person for the first time in a long time, and to, celebrate World Keratoconus Day, which is coming up on November 10th. So we're gonna be together a little bit before that and get to celebrate in a good way.
Yes, and in fact obviously with the plan that we have about our roundtable for to share with the doctors at the Academy of Optometry in celebration and recognition of World KC Day, which I'm really excited about. But I know that we also have a very special theme today in terms of the many questions that you've have selected from the submissions that we have. Can you maybe tell our listeners a little bit about it?
We just want to raise awareness about keratoconus, about life with keratoconus especially. So this episode, we chose some questions from patients about just everyday experiences that keratoconus might affect, and maybe some things that other audience members haven't even thought about.
Yeah, I'm sure. And that sounds like a great idea. And so, those of you who we may not have gotten to your questions, thank you so much for all the questions that you are sending in to us. And we'll definitely keep them and make sure that we get to them, hopefully in a future episode. And I do also want to point out that I got new glasses just for World KC Day. So yay. But without further ado, thank you. I'm going to pass it back on to Taylor, and then you could tell me what questions the audience has sent in today.
Sure. So our first question comes from Marie, and Marie writes, I was diagnosed with keratoconus a few years ago. I have slight keratoconus changes in my left, but not in my right eye. Could this be causing my current imbalance and dizziness?
Yeah. So yes and no, but let me explain. I know that sounds like a cop-out, but let me explain. So visual imbalances and differential visual blur between eyes, because she said that one eye has a slight change. So the differential visual blur between eyes can certainly contribute to symptoms of, say, dizziness, eye strain, especially if you don't have the proper correction, meaning you didn't update your prescription, whether in glasses or contact lenses, to reflect the progression of your keratoconus, or dull ache across the, typically more across the front of your head and on the side. and or even postural headaches from the base of the neck up, because we're trying to get into better positions to focus in front of the electronic devices or computer terminals, or even like bumping into objects on the side that your vision is not as good, among many other things. And not to even mention that the increasing struggles that keratoconus patients can have with ghosting images, double vision, triple vision, glare, halo, starburst that they experience more than other people. So because of that, anything that leads to like a visual impairment, especially more one-sided, such as from keratoconus progression, or even like a very dense cataract on one side, for example, can actually produce very similar visual symptoms of that strain and dizziness that Marie is referring to. So the degree and severity of her keratoconus progression, which we don't have the detail of in terms of how much progression or how bad the baseline severity is, but that may actually justify the visual symptom of that dizziness that probably my assumption would be gets worse throughout the day as with increasing visual usage, and especially when, like I said, when you don't have the most updated glasses or contact lens prescription that's appropriate for after the progression has been diagnosed. That is definitely possible. Or especially when you're trying to perform tasks with very high visual demand, like I talked about, in front of electronic devices and terminal. But it, for example, won't make sense if you wake up with that dizziness because you haven't really started using your eyes, right? But regardless, so far, I know what Marie is thinking. So it sounds like a yes. So why did you say yes and no at the beginning? So let me just put like a very little caveat at the end here to this question. So such visual imbalance from keratoconus worsening should not, however, contribute to, say, muscular weakness or loss of, muscular control. So if by imbalance, Marie actually meant that she's experiencing some sort of muscular weakness, then it's unlikely to be associated with worsening of her keratoconus in the left eye. So in any case, I recommend that Marie speaks with her own eye doctor and her family practitioner to just, as a start, just to make sure that all systems are reviewed so that she can get the, best care and get to the, hopefully a resolution faster.
Wonderful. So you would say the first action item is to go talk to her doctors, and is there anything maybe in the in-between time that she can do? Maybe more pauses in between working on the computer or anything like that?
Yeah, so if it's truly visual related, the first stop is probably should be updating that prescription, whether it's in glasses or contact lenses, to reduce the imbalance between both eyes. So I certainly would say the first trip should be to the eye doctor, and then certainly take, if it's visual stress related, then that's a great idea of what you say, Taylor, taking more constant of small breaks in between different tasks that she's doing, lubricating the eye, so that, because dryness of the eye can also contribute to eye strain and headaches and pain, and that sometimes can can escalate the other visual symptoms like dizziness that she's already experiencing. So lubricating your eyes with preservative-free teardrops can be very helpful, but I want to make sure that we don't kind of forget about other systems and organs, and so that's why you should also set up an appointment to see your family doctor.
That's great. Okay, well, our next question comes from Janice, who asks, does pregnancy go well while having keratoconus and very thin corneas? Can pregnancy make damaged corneas thinner?
Right. And Janice, the having keratoconus is an eye condition only, meaning that there's no other systemic associations or comorbidities that have been diagnosed. So if it's just, just for the eye only as an eye condition, it doesn't appear, keratoconus does not appear to affect the outcomes of pregnancy. At least such correlation have not been made in medical literature. But the second part of your question is different. The second part of your question is sort of the flip side of the relationship, right? So can pregnancy make keratoconus worse, right? And so the answer to that is probably a yes. So unfortunately, we don't quite know how to predict whose keratoconus will get worse during pregnancy or after pregnancy. And back in spring 2017, I know I'm digging. Can you sense that I'm digging really far now? Back in spring 2017, in an NKCF newsletter, I had commented on a publication at that time was recently published from end of 2016 from Tehran University by Nadarin and al., who actually tracked a small group of 11 female keratoconus patients who were pregnant, and all 11 patients show further corneal thinning and steepening by their third trimester during their pregnancy. And they also complained about corresponding visual reduction or decreasing vision. But however, I don't want to set off false alarms. So before all the mothers to be with keratoconus out there hit their panic buttons, I just want to also say that that study contained a very small sample size of 11 female patients, and they didn't follow the patient. They followed the patient out to 6 months after delivery, but not beyond that. So it is also unknown it's hard to conclude from that study whether or not that keratoconus progression observed during pregnancy can maybe be reversed in terms of returning to their baseline. And also, additionally, just anecdotally, I personally have seen, enough patients with keratoconus, female patients, who don't exhibit worsening in their keratoconus after pregnancy. And so, however, I do want to say that we do believe that, in case you're wondering, well, why pregnancy? We believe it's possibly linked to estrogen hormone fluctuation, right, during pregnancy, because there are estrogen receptors within your corneal tissue, but the mechanism is very unclear in terms of how the activity of your estrogen fluctuation during pregnancy actually directly causes thinning and steepening. We don't quite know what the mechanism would be. Except it even has been reported in a case report that taking hormone replacement therapy could even, or at least in that one case, led to onset of keratoconus and progression of keratoconus. So regardless, I would recommend that our female keratoconus patients to discuss with their eye doctors prior to family planning. It's important to maybe do it ahead of time, right? Like if you've been stable, but you're thinking, planning a family, to just make sure that you're keeping, and your eye doctor is keeping a close watch on your keratoconus condition before, during, and after pregnancy, and try to reduce your risk factor that sometimes we think could be linked to further progression, such as eye rubbing. So I would definitely recommend trying to control any possibility of any type of stimulus that would lead to eye itching and eye rubbing. And if you just do it by habit, then don't, hopefully listen to me and try not to do it.
Great. And do you know of any research about getting cross-linked before getting pregnant, if that would kind of prevent this from happening, or is it kind of unknown?
Yeah, that again, that's a really good question. You're not letting me off the hook. I stopped short of making that comment because I thought, this can be a future question. So while it's not approved that's not an approved indication in US, because most studies don't involve pregnant patients, because we don't want to have to worry about vulnerable populations such as mothers to be, such as baby or fetus. And so there's just really no data even though we know riboflavin is just vitamin B. And you could take obviously a nutritional supplement during your pregnancy, but because it's not done, that's not an approved indication in US. However, I will tell you that in many European countries, if you look at medical literature, they actually, because of such link, there are hospitals and medical centers that actually recommend cross-linking stable patients prior to their family planning and pregnancy, just to make sure that they're maximally protected. But I do want to again mention that that's not an approved indication in US.
Great. Okay. Well, our last question comes from Peter, and he writes, is concentration affected by someone having keratoconus?
Yeah, so I hope the listeners out there can see how many aspects of daily life in a keratoconus patient is impacted by their condition, even though you may not be able to perceive their physical disability. Because before I answer this question, just because I have a lot of patients with their family members who, and even friends around them, who don't really understand exactly why are they sluggish or lethargic, or why don't they respond as fast as they think that these patients should be, because they physically look really good to outsiders, right? So I just want people, family members and relatives and friends out there of keratoconus patients, please take note of these questions, because so the answer is yes, it can, like in terms of impact of focus and concentration, because very similar to Marie's question about dizziness related to poor vision. Keratoconus with or without progression we know obviously results in different degrees and visual impairment, which can be very severe pending again the severity of the condition. So this is the relation between vision and keratoconus and your sort of mental concentration is the reason why, remember, how we usually hear people saying, hey, I'm a visual learner or I'm an audio learner, right? Why do they say I'm a visual learner? Because much of our interaction with our surrounding and how we learn is very heavily visual based. And I don't just mean like visual acuity, like how many letters can you see on a chart in clinic. That's a big contributor to our visual function and our overall performance in daily lives. But don't forget that in previous episodes, we spoke about the fact that your eyes are connected to your brain, and that it is through the visual processing center in the brain that we perceive our vision. So there are many different dimensions to your visual functions that can be negatively impacted by keratoconus and its corresponding poor vision. So it certainly can affect your visual processing and your visual focus, and therefore your mental concentration. And also in limited medical literature, Taylor and I were just talking about this actually, that keratoconus has even been correlated to varying degree of anxiety, depression, increasing sensitivity to physical pain, or at least the perception of pain. And so all things that we could talk about in the future, but also all things that we don't really want our listeners to experience themselves. So again, I just, in support and recognition of World KC Day, please send in your questions. Let us help answer them for you if that helps you. And we're here to support all keratoconus patients. So back to you, Taylor.
That's great. Yeah. Well, thank you again, Dr. Chang, for taking the time to answer some of these questions for our NKCF audience. Next month, look for another Chang Reaction episode with answers to more questions about all things keratoconus. If anyone listening has a question that they would like answered in a future episode, go to the NKCF website and under the For Patients tab, you'll find the Ask the Expert Chang Reaction tab. You can post your question there and we'll try to answer it during an upcoming episode. NKCF operates with the support of friends and donors. If you feel the urge to support us, you can make a much appreciated online gift to the UCI Foundation. In closing, I just want to thank Dr. Chang again for taking the time to work with us every month and answer some patient questions, especially this month as it's World Keratoconus Day. So thank you very much.
Oh, you're welcome. Thank you for making me part of this family. And I want to tell everybody happy World Keratoconus Day on November 10th. I hope that we all get online and share our experience, and hopefully many of them, story of joy with our friends and relatives, so that they could also understand what you're going through. So thank you and see you next month.
Bye, everyone.
Bye.